Now, the Ghana Health Service is calling on other government agencies and partners to urgently invest in holistic services for young children, especially those at risk, to give them the best start in life. Now, the Ministry of Health and its key partners have outlined actions to roll out a global initiative on the nurturing care framework for early childhood. Now, development starting at early childhood is something that they want to push for with a national launch to jumpstart implementation of activities in the country. Let's get some details of that. In studio with me is Dr. Patrick Kuma Abuaje. He's the Director for the Family Health Division of the Ghana Health Service. Dr. Kuma Abuaje, thank you very much for your time.
Thank you, Kojo.
So walk us through it. Which aspects of health, early health care for children are we focused on with this upcoming event?
Well, I mean, the background whole issue is the fact that we realize that as a people, we are not achieving our full potential. And the causes have been traced to an early childhood, even before you are conceived and during pregnancy. In the early part of life, that is when a lot is required that you are able to develop your full potential. We have realized that when you have the part of Europe and America where this has been eliminated, in most parts of Africa, almost 60% of all of us, I mean adults, do not achieve their full potential because we didn't get what we are supposed to get in childhood. And this requires having adequate nutrition. It requires good health, opportunity for early learning. Reading to your child whilst being pregnant and reading to your child in the early stages, opportunity to play and learn, to have to respond to stimulation of the brain, for the brain to develop it fully. And we realize about the time that we need to start that, including good nutrition, breastfeeding early enough, so that we all can achieve our potential. And I think it is something that is causing not only Ghana, but Africa, a lot of money, a lot of losses for non-action, and we feel this about the time that we look at that. We've had a policy on early childhood development since 2004, but it's an opportunity for us to jumpstart and move it in the early part of life.
Now, this, as I understand, is a global initiative.
Yeah.
So how are we planning to roll it out here in Ghana?
Well, last year, we launched it in June last year. We had a stakeholder meeting and a media encounter last week, primarily to get the information out there, because we believe that if parents and caregivers know some of these basic things, that'll be a lot of the problems solved. That's feeding your child properly, breastfeeding your child, reading to your child, allowing your child to play is something. Now we are going to develop as a multi-stakeholder group, to come up with another blueprint on how we can look at it. Now focusing mainly in the nurturing care, which is about the first 1,000 days of life. That's from during pregnancy all the way up to about 2 to 3 years, where we intensify all the efforts. And those are the areas that when you miss the opportunity, it's very difficult to catch up.
Now, are you liaising with the Ministry of Education? Because, you know, here in Ghana, even babies are tested. You know, the opportunity to play isn't something that they focus on when they go to kindergarten. They're tested from the very first day they set foot in the classroom. Is that helpful for children?
Well, I don't know the kind of tests they are doing, if they are testing to see cognitive ability, etc. But if you are asking,
you do exams.
If you are taking exams, then probably that is not the best way we should go about. But we are working with Ghana Education Service, especially the early learning development department, the special education unit. We are working with Ministry of Gender, the Department of Children, and trying to get UNICEF, UNFPA, the USAID. They are all part of the partnership that we are working towards putting our act together, bringing all the services we are rendering in a way that promotes a nurturing care, to ensure that even adolescents, before they get pregnant, they will stay in good health, and that when you are pregnant, you go early, you avoid illness, you don't have malaria, you feed yourself properly, and then immediately you deliver, the child is given, put to breast, and prevent infection, and all those things that allow the child to have the best of health and of course also provide safety to ensure that there are no injuries in these early parts of life. Yeah.
Now, it looks like a very ambitious plan, something that you want to engage all parents in Ghana in, regardless of their education levels. So let's talk about funding. I mean, how are you planning to fund this big initiative?
Well, I don't think, well, we'll need funding, a lot of funding, but also it's worth the investment, because if you put in more, you get more out of it.
And investment by who? Government?
Well, government, parents, everybody, because like I mentioned, it is something that may not require so much. All we are saying is that breastfeed your child, because it's cheaper than buying artificial food. Keep your child warm. Make sure you go for antenatal care, which incidentally is free in Ghana. Make sure that you're feeding your child properly. After 6 months, start your complementary feeding. Make sure the child is well nourished. Allow the child to play. I'm not saying computer games. Make simple toys for the child to play, because the brain needs to be stimulated as it grows. The brain, in the first few days after delivery, is about 10,000 new connections are made every second, not every minute. And this is based on the stimulation, the language. You hear people talk, people read to you, people are playing, you are getting curious, what you see, what you hear. Even babies in their womb can hear. You see, so these are the things we are looking at. These are things we probably can do, I'm sure, before the advent of busy life. These were things parents were doing.
So that's how parents can contribute to their own children's welfare. But I'm asking about the campaign itself, of putting that information out there, going around the country, educating people. That all needs to be funded, doesn't it? Yes.
So we're working with our partners, and we are hoping that the government will also give us some support to be able to work with the media, make sure that our nursery attendants are trained. Caregivers, especially in the urban areas where most parents leave their 6-year, 3-month-old babies with caregivers and go. They are all trained with all these basic things about the stimulation and play, feeding. So those are the areas that we feel we need resources to work.
And has government already committed to supporting this project?
See, some of the things we are doing, like providing delivery services, antenatal care services, exclusive breastfeeding, these are already funded.
Okay.
But to go out there, you need an additional push to be able to reach more people.
And have they agreed to that?
Well, I believe so. Because it's part of the government's key agenda that was launched last year. We signed up to it in Geneva last year, and that's why we are also talking about it. We are government agencies, and so
is there a time frame for which this project will run?
I wouldn't want to put the time. I've been asked this question several times. We don't really need a time frame. This is something that we must institutionalize
on an ongoing basis.
Because as long as we want to achieve our full potential as a people, these things must continue and do better.
You must have some measurable success criteria, right? I mean, every year you want to achieve some quantifiable goals. What are they?
Well, we want to ensure that through all this, the previous clip we are playing about the children with disability, that's one of the things. Once done properly, children born with disability will significantly be reduced. I want to ensure that we have birth injuries are as minimal as possible. We want to ensure that children who are stunted, children who are chronically malnourished, so they get shorter for their age, children who are wasted because they are not getting enough food, once those ones are reduced significantly, what we can say then is that these children are being nurtured properly. There are things like play, there are things like reading to your child. We will need to definitely ensure that we imbibe that in the population, in the caregivers, to ensure that these things are done.
So what I'm asking about are quantifiable goals. So by the end of 2019, you want to have spoken to how many parents, or you want to have got how many parents signed on to the project, or you want to have seen a turn in the trend of children with stunted growth by what percentage? You know, that's what I'm asking about. What are these goals?
Okay. Currently, we have stunting about 20%. We have a goal of reaching less than 15% in the next 5 years. We want to ensure that as part of the SDG by 2030, only less than 12 newborns die before the first month of but before the end of the first month. And these are all quantifiable goals. Of course, we may not be able to talk about the outputs here in terms of what we want to put in, but in terms of the key outcomes, we want to ensure that these things happen. We want to ensure that currently children who get, babies who have exclusive breastfeeding is about 52%. We are targeting 80% by the year, in the next 5 years. So these are the things, but you see, nurturing care is a cluster of things. And these are the broad things that when you start getting them, you can be sure that the children are being nurtured properly.
Right. Well, Doc, I've got to thank you very much for your time with us. Very educational, and we wish you all the very best with this initiative.
Thank you very much.